Welcome back to The Source. Let's check in now with Niagara's Acting Medical Officer of Health, Dr. Mustafa Hirji. Dr. Hirji, administration of the vaccine, the Pfizer vaccine, had to wrap up this week on Wednesday because of a shortage of supply due to Pfizer's delayed shipment. How serious is this delay going to be in, I guess, delaying the rollout of the vaccine here in Niagara?
So what the delay is that because they're updating some of their production lines to actually increase capacity, it's unfortunately leading to a short-term reduction of capacity. And what we've heard is Canada is no longer going to receive any more vaccine for the rest of this month, and it's going to be reduced for the start of February. The implication of this is what vaccine we still have, we can still keep using. But because there's only limited vaccine, the provinces decide we have to prioritize that to long-term care home residents and retirement home residents, who are the ones who are having the most serious illness and the ones passing away. And that means, of course, that we've had to wrap up vaccination of long-term care home staff, retirement home staff, and our healthcare workers.
Do we have enough of the Pfizer vaccine for the second dose that has to be given between 21 and 28 days after the first?
We don't have enough for that. We are, sort of the good part of our late start to vaccinations in Niagara is that we're still 2 weeks away from anybody needing a second dose. So my hope is that by the time we're 2 weeks in, we're into February, we'll start getting doses again and we'll have those second doses available.
Do we know how many people were vaccinated by the end of Wednesday here in Niagara?
The number that's been vaccinated by us in public health is just under 2,500 at the end of Tuesday. I'm not sure what it'll be end of Wednesday, but a few hundred more than that. I believe Niagara Health is close to 2,000 as well. So we're looking at, at least 4,000 people have been vaccinated already and would need second doses coming up in 2 to 3 weeks.
The news came out last week about the delay of the Moderna vaccine here in Niagara, or at least the supposed diversion of the shipment that was supposed to come to Niagara to somewhere else. How serious was that change in affecting the rollout?
I think it's becoming more serious as time goes on. Given that we're no longer having as much Pfizer vaccine, we are feeling not having that Moderna vaccine even more, because that is vaccine that we could be using instead while we're waiting for Pfizer shipments to start up again. I think losing that vaccine meant that we had to work with Pfizer vaccine, which is a little bit less flexible and has slowed down our ability to get vaccine into long-term care homes and retirement homes and vaccinate those residents who are really the ones at greatest risk. It's also meant that we're constrained. We can't be doing all of the residents and all of the staff at the same time because we've had to space it out. And so we've had to focus more on the residents and delay the staff and only do fewer number of them at a time as a result.
Dr. Hirji, we heard earlier this week that the province wants to see the number of infections per day down below 1,000 before they lift the state of emergency. Is that your understanding?
I haven't heard him say specifically that we would need to be under 1,000 before lifting this state of emergency and lifting the stay-at-home order, but that certainly does make sense. That we would want to be getting down into those relatively low numbers to feel like it's safe to start to recalibrate.
Niagara's numbers per 100,000 are now bigger than Halton's and Hamilton's. That's kind of alarming because for most of the time leading up to December, we were doing better than most other regions in the province.
Once cases start to go up, we really hit the tipping point where our long-term care homes, public health, our hospitals really got overwhelmed by what was happening, and we're no longer able to manage and control the number of cases spreading in our community. I think it's not a great sign that we are up there with the number of cases per capita similar to Peel Region. I would note that the other region that's in that ballpark with us is Lambton County. And if you look, Peel Region got vaccines starting the week of December 21st. We got vaccines starting last week, the week of January 11th. Lambton County doesn't actually have any vaccine yet. They're not going to get it until sometime in February once Pfizer shipments really resume. And I think that really speaks to some of the inequities of how vaccine has been distributed across the province.